Morning, everybody. My name is Representative Michael Howard, and I represent Richfield and Bloomington in the Minnesota House. Right now, Minnesotans with type 1 diabetes are asking questions that for many of us are difficult to comprehend. Should I buy groceries or buy my life-necessary insulin? What if I take a half dose today? Can I make it to my next paycheck? What if I lose my job and my health insurance? Will I lose my life as well? This is the reality for thousands of our friends, neighbors, and family members across our state. And we have the power to do something about it, and the solution continues to be right in front of us. Those of us up here have been working to pass Alex's bill for more than a year, and we have been negotiating with Senate Republicans for what feels like that long. Unfortunately, those discussions have not produced an agreement that would be in the best interest of patients, of Minnesotans. There remains a large divide on the key question: whose side are you on? Minnesotans who can't afford the crushing cost of their insulin, or the drug manufacturers that have profited richly as they've jacked up the prices higher and higher and higher? Republicans want insulin manufacturers to pay less and for Minnesotans with diabetes and taxpayers to pay more. They insist on barriers to affordability and access that make things easier for the drug manufacturers and harder for patients. And they insist on sunsetting this insulin program in less than 3 years. And for the life of me, I cannot understand why we would sunset what will be a lifeline for Minnesotans. Every one of these areas where we face a divide, Republicans are siding with insulin manufacturers instead of Minnesotans. That we simply cannot accept. So today, we stand with Minnesotans, ready to move forward with the Alex Smith Insulin Affordability Act in the 2020 session with the urgency that this crisis demands. Alex's bill is ready for legislative action, and it's ready to be implemented. It ensures Minnesotans have access to insulin that is affordable when they need it, and it's paid for via a shared funding stream, with the state primarily picking up the setup costs and the insulin manufacturers mainly covering the cost of the insulin. We think that is eminently fair. This bill merges ideas from Democrats and Republicans and represents what should be a consensus that puts patients first. It should not be lost on us that had we passed Alex's bill in the 2019 session, it would be the law of the land. Those Minnesotans contemplating those impossible questions, those gut-wrenching questions, would have Alex's law as a safety net when they need it most. That should weigh heavily on all of us, but especially those who seem comfortable with the status quo. We simply cannot lose another Minnesotan on our watch. Everyone up here today is ready to do everything in our power to pass the Alex Smith Insulin Affordability Act and make sure that that doesn't happen. Next, I want to introduce Speaker Melissa Hortman.
Well, as a mother, I couldn't be more frustrated. It has been nearly 3 years since we lost Alex Smith, and his mom, Nicole, has dedicated her life since then to making insulin more affordable, so nobody has to go through the tragedy that her family went through. But then last summer, we lost Jesse. It has been 673 days since House DFLers introduced the Alex Smith Emergency Insulin Act. Representative Erin Murphy introduced it in March of 2018. We have been fighting to get Republicans to allow us to have the pharmaceutical companies participate in a solution and pass something that works for Minnesotans. And time again, they side with the pharmaceutical companies instead of parents who are losing their children. We know, because of the price spikes, that these pharmaceutical companies are making tons of money on insulin. We also know they can afford to participate in the solution. It is well past time. We will pass the Alex Smith Emergency Insulin Act in the Minnesota House of Representatives again under DFL control for the second time when we convene this year. But what would be great would be to have Republicans come to the table and reach a deal with us so it could pass both the House and the Senate, and we could put it on the governor's desk and he could sign it into law. Next, I'd like to introduce the Lieutenant Governor, Peggy Flanagan.
Good morning, everyone. We want to thank you for joining us as we unveil our 2020 insulin proposal. As many of you have heard the news about my dad, we lost him this week. I can't help but think of him when we talk about this issue because my dad had diabetes and needed insulin. I knew someone who is very close to me who was affected by this issue, and I know that there are so many of us in this room and across the state of Minnesota who do too. That is why this common sense legislation was created in partnership with Minnesotans who have bravely shared their struggles to afford insulin. This legislation is centered around patients. It creates a safety net to ensure Minnesotans can get the insulin they need at a price they can afford. This legislation takes the best ideas from the Democrat and Republican proposals and was written in partnership with advocates themselves, the ones who live with the consequences of not passing this legislation to address the cost of insulin every single day. This is a solution that can and should pass, because it is our responsibility as state leaders to ensure Minnesotans have access to the life-saving medications that they need. We have worked tirelessly to find a solution that everyone is willing to support, and we remain eager for a bipartisan path forward. What we are proposing here today is fully operational and includes Republican ideas, and the best part is that we can begin implementing it immediately. But we must act now. Lives are at stake and people literally cannot afford to keep waiting. It's on all of us here at the state capitol to do the right thing. Let this common sense solution move forward and provide much needed relief to Minnesotans struggling to afford their insulin. Thank you. And now I would like to introduce an incredible advocate who I've had the pleasure of getting to know over the last few years, and that is Nicole Smith Holt.
This is Alec. So my name is Nicole Smith Holt, N-I-C-O-L-E, Smith, S-M-I-T-H-Holt, H-O-L-T. By now, I'm sure that most of you are familiar with my son, Alex Smith, and the story of his death. It's been 2.5 years since he died because he could not afford his insulin. And since Alex's death, we have lost 2 more people in Minnesota to the high cost of insulin. I'm positive there are more. They just have not come forward yet. Every single day, more Minnesotans like Alec and Jesse are rationing their insulin and putting their lives at risk because they simply cannot afford the skyrocketing prices. Since the start of the new year alone, I have received more than 25 messages from people with diabetes asking for my help because they can't afford their insulin and they do not want to die. That's why I'm here today, because we cannot continue to sit by and wait. Each and every day that we delay taking action puts another Minnesotan life at risk. How many more have to die before something gets done to reduce the skyrocketing price of insulin? How many more people are going to suffer long-term complications from rationing? How many more families will be forced into bankruptcy? I am asking the Minnesota legislators, what is that magic number? When can we see progress? When will the people of Minnesota have an insulin affordability bill? We thought we were getting somewhere after the many months of positive negotiations to agree on an insulin plan. But then pharma got involved and derailed all of our progress that has been made. We can clearly see that pharma has been involved with the creation of the Senate's written offer. I stand up here today, and I'm telling you all right now that we refuse to allow pharma companies to continue to get away with putting people's lives at risk. We will not sit here quietly and allow pharma to keep killing our loved ones. Our elected leaders need to put the lives of Minnesotans with diabetes ahead of the profits of pharma. Stop allowing their influence to guide you and start doing what is right. We need to act now to save lives, make insulin affordable and accessible, and hold the pharma companies accountable. I'm standing with the legislators who are standing with and working with the people of Minnesota to prevent more deaths. Thank you. Oh. Alexis is next.
Hi, my name's Alexis Stanley, A-L-E-X-I-S, Stanley, S-T-A-N-L-E-Y. I'm 20 years old and I'm a junior at Concordia University in St. Paul. It's been 121 days since Governor Tim Walz called on the state legislature to reach a deal. It's been 105 days since I stood in solidarity with the governor pressing lawmakers to reach a compromise on insulin. How many testimonies am I going to have to give that start with the amount of days that have passed by since nothing has been done? In those 121 days, I've seen way too many posts on social media from diabetics about not being able to afford their insulin or start rationing. Type 1 diabetics should not have to resort to social media to get their life-sustaining medication. My insulin went up from $269 to $324 in the month of December for no reason. Nothing about it has changed. It's still the same tiny, life-saving vial it always has been. Think about the ones who are uninsured, struggling to afford their insulin, as it is already, having to deal with a $55 price increase. Growing up, I always knew there would be consequences for my actions. If I did something, I knew there would be impact somewhere, but it was because of me and something that I did. What I'm getting at is, I did nothing to get type 1 diabetes. No type 1 diabetic has. And yet we're paying for the actions of the greedy pharmaceutical companies and lawmakers. And me, along with the rest of the diabetes community, are facing the consequences for that. We are facing consequences for the lack of action by our lawmakers, and our lives are in their hands. The progressives in the House have reached out and talked to advocates. Most of them who are working towards affordable and accessible insulin know me because they've taken the time to talk and listen to advocates and allowed us to be a part of this process. They're taking so many steps in the right direction, but they can't do it without the help of the Republicans in the Senate. Diabetics can't keep waiting, and we need action now. And we're going to keep fighting until we have affordable, accessible insulin for all. And we need all of our elected leaders to stand with us. Thank you. And next up is Annette.
Hi, I'm Annette Gentilly, A-N-N-E-T-T-E-G-E-N-T-I-L-E. I have had type 1 diabetes for 32 years. I am on disability and I receive $1,200 a month. My insulin costs are over $900 a month. So I have to make a choice between my life-saving medicine or to live in a home with a roof over my head. I can't afford the roof over my head, food, and other necessities and buy insulin at the same time. There are times that I haven't bought food, I haven't bought gas. I would skip buying my heart, depression, and other medications that I need because I need to buy my insulin so I can live. I also have a 17-year-old son that I have to take care of. Because I can't afford the cost of my insulin, I have rationed and gone into DKA and was hospitalized at least twice. I used to be ashamed of my situation and I didn't tell anyone, not my family or any of my friends. And I know there is others that are in the same situation as I am, embarrassed to tell their friends and family that they can't afford their life-saving insulin. Instead, they ration it and put their lives at risk every day. In fact, more than a quarter of people with type 1 diabetes in the U.S. ration their insulin. But this is not our fault, and it shouldn't be this way. In the last decade, the cost of insulin has tripled. It is not fair that we're putting our lives on the line while Big Pharma is making billions. Time for our elected leaders to put our health and our lives ahead of pharmaceutical companies. We are getting hurt by these big pharmaceutical companies, and they, like I said, make billions. But we are not backing down. We are going to keep fighting for affordable and accessible insulin for all. Thank you. Next speaker is Jett Laue.
Hi, my name is Jett. I'm 9 years old. I like Legos, Minecraft, Star Wars, Pokemon, and reading. I've had diabetes for almost 3 years. I take insulin every day. I am worried about what will happen to me when I become an adult and need to pay for my own insulin because I know it's so expensive. I don't want to become like Alec or Jesse. So I'm asking our elected leaders to pass Alec's bill and protect kids like me with type 1 diabetes. Thank you.
Thank you, Jett. Thanks for taking the time and thanks for your advocacy. Thank you and good morning, everyone, for being here. A special thank you to all of our advocates, for Nicole, for your unwavering voice, the conscience of Minnesota on this issue that you have brought to the forefront, to Alexis, who she's right. Alexis is on a first-name basis with everybody around here because she's found a way to be a full-time student, work, and then come here and advocate and make the case. To Annette, spoke so clearly, do the math. She told you where it's at. It's $900 a month. It doesn't cost any more than it cost in 1983 to manufacture it. Wages certainly haven't gone up at the companies that make it at the same pace as the costs have gone up. And we know last year that the three major manufacturers had revenues in excess of $80 billion. And then, of course, to Jett again for the remarks. I want to point out the legislators who are here, who are doing the job that they're supposed to do. A problem came up, a market failure in our society. Folks who rolled up their sleeves and have worked at this. Mike Howard has been a relentless champion of this and an expert in the details of what it takes to actually make this work. It's one thing to say we need a solution. It's another to actually offer one that can be implemented and that works. So I want to thank Mike for that. Representative Liebling, who has been a champion on all of our issues across healthcare and continues to remind us that this is the first of the decisions that we're going to have to make around affordability of healthcare, and it's going to let people come down on where they're at. And you've heard the advocates say there's a pretty stark difference here on why this bill is being held up. To Senator Wickland, thank you for your work continuing to advocate for what's right, and to the Speaker of the House for ushering this through. And to be very clear, passing a piece of legislation that, had it got done, could have been signed into law. You heard the numbers. Insulin has tripled, and in this case, Alexis talked about it, a $50 increase. You heard the choices that Annette has to make. It's totally unacceptable. We've been saying this for months. We need action, and we need it now. After weeks of closed-door discussion, it's time to let the sun shine in. That's why I want to congratulate the House on the pre-filing of this compromise legislation. They took the best of Democratic ideas and Republican ideas in a compromise bill that will increase access to affordable insulin, hold Big Pharma accountable, and is ready to be implemented now. It ensures that Minnesotans facing an emergency, those in most danger of rationing due to the high cost, have access to an immediate refill at a pharmacy. It builds upon a bill introduced the last session that included the Republican idea that creates a long-term program to provide eligible Minnesotans access to affordable insulin. It makes the pharmaceutical companies who created this crisis help be part of the solution. Lives are on the line. There's a solution setting in front of us. It's fully operational. We can begin implementing it immediately, and lives will be impacted. There is absolutely no reason for us to wait any longer. I congratulate the introduction of this. I advocate for its speedy passage, and I ask the Senate to pick up a companion, pass this, and let's move forward. And with that, we'll be glad to answer any questions.
Governor, is it fair to call it a compromise when one party is here?
Yes, it's fair to compromise because the legislation that's here that we've been asked time and time again, and what you're going to be able to see is the proposals that were exchanged. You can see where compromises were made, where movement is made. And I think, again, I'm going to ask all of you, ask the questions that need to be asked. The first one I would ask is because I'm hearing this from some legislators, is There's no problem. Why do we need to do this? The market has fixed this and the situation has changed, which is fundamentally absolutely incorrect, and these folks would tell you that. And the second question I want to ask you is, why shouldn't the manufacturers have a role in this? I'm not asking them to pay for it all. We'll assume standing this up, we put the operational piece in place. We talk to all the advocates, and this idea of a compromise, I would ask these advocates how many times they were invited in to craft the Senate compromise bill, how many times they were there to be asked. So yes, this is a compromise piece of legislation. Just because they don't accept it does not mean that it's not a compromise. It means, and we're seeing it, that the sticking point remains the same as it was in May of holding the pharmaceutical companies accountable. And I would make the case that this is eerily similar to why we wasted an entire year around the opioid epidemic, because we had 28 lobbyists up here advocating that the opioid manufacturers shouldn't be part of that. Well, we know what happened last year when they finally were pulled to the table and be a part of it. That is now being implemented and we're saving lives. So
what's the mechanism here? Is it a licensing fee, or are they paying for the actual insulin dispersed through the program?
The bill we're introducing includes a fee on manufacturers, and they would primarily be used to cover the cost of the insulin in the emergency program. For those seeking long-term insulin, manufacturers would provide the supply of that. And what I would say about that, that's structured basically right now to basically parrot what these manufacturers are already offering in terms of their patient assistance programs. I just want to, the Senate, they would, basically what we've heard over and over from the Senate is they want to utilize the status quo and what manufacturers are using. So they would term the contribution from manufacturers, the supply of insulin they're providing in the long-term program. But in their latest offer to us, they actually included a copay for Minnesotans at the doctor's office. Back in the fall, they were talking about free insulin. That's gone from their proposal. They're now expecting patients to pay a copay at the doctor's office to receive their insulin. And in doing so, they would prefer a long-term program that is less of a benefit to Minnesotans than the existing pharmaceutical company programs. So they'd be creating a program that nobody in their right mind would want to utilize. And so that just sort of gets at where we've been at with Republicans. And in some ways, in some areas, they've made some progress towards us, but in others, they moved the goalpost back. And every time they've done that, it's away from a patient-centered approach and more towards something that the pharmaceutical companies would choose.
Just as a follow-up, has there been any shift in whether there's going to be any means testing or income eligibility in your proposal, or is this, if you say you need it, you'll get it?
So on the emergency side, we have crafted a set of eligibility standards that Minnesotans would attest to and be able to receive an emergency supply of insulin. To obtain the long-term coverage, there are some eligibility requirements in terms of filling out an application to see if they qualify for long-term insurance coverage through the exchange or other ways. And the eligibility that we have in our bill includes folks that are basically, we're targeting the population that's most at risk, and that is uninsured Minnesotans who are lower middle income, folks with high deductible health plans that have these gigantic out-of-pocket costs, and folks like Annette on Medicare who also are at risk with enormous out-of-pocket costs.
And Mr. Representative, what's the dollar amount that you are asking pharmaceutical companies to kick in, not only in terms of the fee, okay, for the emergency, but the value, as it were, of the free insulin that they would provide? Have you computed that at all?
Well, the insulin, just your last question, it costs the insulin manufacturers about $6 or $7 to create the insulin. So we know that piece of it. We are doing estimates to see, what utilization might be. So we don't know exactly what the fee would assess. We are asking about $1 million from the state in setup costs.
The costs for the pharmaceutical companies are going to be in the tens of millions, or do you have any idea of order of magnitude?
bill that we introduced estimated in the fall around, $10 million. Just on that point, I want to highlight a gap for the folks that think this is punitive or this is too much of an ask from the pharmaceutical companies. As Governor Walz mentioned, there are three insulin manufacturers that control the entire global supply of insulin, essentially. Those three companies had $80 billion in revenue in the last 12 months. Let me repeat that, $80 billion. So we are asking slivers of a sliver for them to help solve a solution that they a problem that they created, and we think that's eminently fair.
In May, we were talking $2 to $3 million program cost, I thought.
Maybe per manufacturer.
Majority Leader Gazelka suggested that there are elements that you agree on already and that maybe you should begin by passing those.
Well, Representative Howard's a real expert on this, but why would we pass a partial solution? Then they would say that the problem is taken care of. I mean, it makes no sense for us to agree to an incomplete solution. I think in the Minnesota Senate that's led by Republicans, they need to free up their members who are willing to work with us and willing to put Minnesotans and patients first. Senator Abler, Senator Jensen participated in the bipartisan working group this summer. They were making considerable progress. And since, leadership came in and put Senator Pratt and Senator Benson at the helm, we have been moving backwards.
Is this something that you're anticipating putting on a fast track, and as soon as you're back next 2 weeks, what's the plan?
Absolutely.
So something should pass off the House floor in February, or what's the outlook?
I can't give you the exact timeline. It depends on how many times we convene and how many committee meetings we can shove into that first week. It has to go through 4 committees to make sure that it gets the proper process, but this is something that's already been considered in the Minnesota House of Representatives. It was very full hearings. I think Representative Howard could tell you how many different committees he went through, but what we're looking at is a new bill. So it's very clear to everybody, rather than putting it on as a delete all to an old bill or sticking it on a conference committee that's already in existence, to provide maximum opportunity to reach a compromise. Because it really doesn't do us any good to have the Democrats in the House continue to pass solutions that work for Minnesotans if the Republicans don't come to the table. The way that we put a bill on the governor's desk is the House passes a bill and the Senate passes a bill. So we are really open. We, I think, have bent over backwards in our flexibility to be willing to reach a compromise with Republicans. But as Representative Howard talked about, they are actually moving backwards from where they were this session. And the thing that's really astonishing is that they're offering less to Minnesotans than what pharmaceutical companies are already providing. They already have a free benefit program. I'm happy to help do the PR for the pharmaceutical companies' free program, but that's obviously not enough because Minnesotans are dying. So we have to do more than that.
Governor, you had an altar call with the industry last year. Any thought of summoning again? I think you did that over the telephone, but.
Yeah, I did one with, especially with the opioid manufacturers that we talked to and told them that. I think you can anticipate that my next step will be to call them and let them know. And my message to the opioid manufacturers is that the cost they were going to pay to help us was going to be small compared to the damage that they were going to have to make up. And we have a situation right now, I can tell you, Minnesotans do not side with the insulin manufacturers. Minnesotans believe the stories they're being told here. And I would go back to that compromise again, that what we're being asked to do is not all things in a bill can be compromised on. I am not going to compromise on getting insulin to these folks. And I am not going to compromise that the pharmaceutical manufacturers shouldn't be part of the solution. So there are many things in there. We were asked to move on percentage of federal poverty limits on what made eligibility. We had discussions on something I agree with Representative Howard. The idea of a sunset is ridiculous, but those are things that at least you can talk about and whether they get rejected or not. But the idea on this is, I think we all know that last week in May, the reason that just didn't pass was we couldn't agree on how it was going to be paid for. The state has accepted this, and I think it was asked of me is, well, can we split it between the manufacturers and the state? Yes, to a certain degree, that's exactly what we've done. So I'll call them again. We will make the pitch. We will appeal to their better angels. But I can't stress enough just the maddening nature of this. I mean, I'm ashamed when we're standing with these advocates when they tell you these numbers, how long they've been waiting. And I truly believe that we could get there. And I'm just telling you, the manufacturers have to help us. They have to help us. It's the only way to make this work.
Governor, you have tried a lot of tools in the toolbox, the bullet pulpit toolbox. What do you do to break this free? And is potential legal action in the mix?
Well, I agree, and I express, I think the speaker said it, I can't really hide my frustration with this. I have tried to do what I can do. The legislature writes the legislation. I've tried to put deadlines. I've asked us to negotiate in public. I can tell you this is going to get very, very hot and difficult when these proposals are put into the light of day and you are looking at what is being accepted and rejected, because I think, I gotta be honest with you, what other reason was there to negotiate behind closed doors unless you're really worried about what you're proposing? And so I think the other tool in the toolbox is the most powerful one in our democracy, public opinion. And this is clearly going to go back to public opinion, that you're going to have to come forward and say what is broken with this proposal that we are offering, and tell the public why, you know, the saintly manufacturers of insulin are being taken prey by these advocates and these Democrats. That if that's going to be your argument, I think that leverage is where we have to go now. I've always believed sunlight's not only the best disinfectant, it's the best mechanism for compromise and movement. Now is that time. So the introduction of this bill takes us to a new chapter. It's very clear now.
One more question.
Could one of the advocates address the idea that the market has solved this and that the situation has changed? Why is that not the case?
So we have seen some movement with insurance companies, and we have seen the insulin manufacturing companies step forward and try to create programs that look like they're helping the type 1 diabetics. But basically, they're all PR stunts. Unfortunately, there's no guarantee that next year these insurance companies are going to offer the same insulin copay caps. There's nobody saying next month Eli Lilly is going to have the same coupon available. Without legislation in place that makes these laws, we have no guarantee. And it's really unfortunate that a type 1 diabetic cannot guarantee that they're going to be alive next month. So we need legislation in place. We cannot accept status quo. We cannot accept our legislators saying, oh, but the insurance companies have put a cap on the insulin copay. Not all insurance companies have done that. Very few people have benefited from that program. Too many people's lives are at risk, and we cannot stand by and just allow this to continue.
Thank you, everyone.